By July 1st, 2020, according to the World Health Organization, there had been 10,357,662 cases reported involving COVID-19, which had been attributed to a total of 508,055 deaths worldwide, over 500,000 fatalities worldwide. By the end of July 2020, when the case count had swelled by over 100,000 to 668,910 deaths, and the worldwide case count had climbed by over 7 million to 17,106,007 cases in Situation Report 193. WHO Regional Director for Europe, Dr. Hans-Henry P. Klug, had emphasized the need to be on the alert to expand capacity to deal with a resurgence of COVID-19, and at that same time, to maintain essential health services. A desperate call, similar to a cry of desperation sounded by Houston Mayor Sylvester Turner on July 1st, 2020, who had claimed that the COVID-19 threat is higher than it has been, and Harris Health hospitals are pretty much at maximum capacity. Emotionally gripped during what the Data Institute at the University of San Francisco has historically associated with public health crises as times of emotion, of fear, confusion, and despair. The Houston mayor had stated, "The threat of COVID-19 poses to our community right now is higher than it has been. There is a severe spread between our families, friends, and communities." And further, Mayor Turner had stressed emotionally that we need to slow it down so it doesn't overwhelm our healthcare delivery system. And in times of hot passions, cool heads are required to develop prevention and mitigation measures reasonably calculated to address that actual and not perceived threat or harm. On July 1st, 2020, in Situation Report number 163, the World Health Organization had stated that it has never been clearer that communication is an important public health intervention that contributes to controlling pandemics. Communication is important. A message at least similar to, yet distinct from, in nuance, that given by the World Health Organization at the end of February 2020, after a robust examination of some 55,924 laboratory-confirmed cases in China by 1,800 teams of at least 5 epidemiologists, 19 times more cases examined than had yet been reported in the entire United States by mid-March 2020, in which that World Health Organization had concluded, intriguingly, it is not clear whether this correlates with the presence of an infectious virus. In major recommendations had designated for countries with imported cases and or outbreaks of COVID-19 to fully educate the general public on the seriousness of COVID-19 and their role in preventing its spread. Fully educate the general public on the seriousness of COVID-19 and their role in preventing its spread. July 2020 was a critical time across America as many states began to transition from phase 3 stages of lockdown to reopening the economy. And at the beginning of July 2020, just short of 3 months after the pandemic declaration, according to CNN, the mixed message about wearing a mask at the beginning of the coronavirus pandemic had contributed to the reluctance of some Americans to wear a face covering now. Dr. Anthony Fauci told NPR in an interview. CNN reported that Americans were first told in February and March not to wear a face mask to protect against COVID-19 transmission, as a shortage of personal protective gear for medical works worsened. But by May, health experts, including Fauci, reversed course and urged people to wear masks in public to prevent the spread of the virus. According to CNN, Fauci admitted that the early message to Americans about wearing a mask was confusing. Without elaborating, he said there were many other things now contributing to why people do not want to wear a face covering. On July 3rd, 2020, the Centers for Disease Control and Prevention had reported that as of June 27th, based on death certificate data, the percentage of deaths attributed to pneumonia, influenza, or COVID-19, abbreviated as PIC, P-I-C, decreased from 9% during week 25 to 5.9% during week 26, representing the 10th week of a declining percentage of deaths due to PIC, and had concluded that the percentage was currently at the epidemic threshold, but would likely change as more death certificates were processed, particularly for recent weeks. And by July 2020, according to Pew Research Center, most Americans, 71%, had heard of a conspiracy theory circulating widely online that had alleged that powerful people intentionally planned the coronavirus outbreak. And a quarter of U.S. adults saw at least some truth in it, including 5% who said it was definitely true, and 20% who said it was probably true, according to a June 2020 Pew Research Center survey. According to the Pew Research Center, however, in July 2020, the share of Americans who saw at least some truth to the theory differed by demographics and partisanship. And at least according to these learned survey researchers, educational attainment is an especially important factor when it came to perceptions of the conspiracy theory. Around half of Americans with just a high school diploma or less education, 48%, said the theory is probably or definitely true. Half of Americans with a high school diploma or less. But they emphasize that compares with 38% who have completed some college but have no degree, 24% of those with bachelor's degrees, and 15% of those with a postgraduate degree, with the implication that if you had believed the conspiracy theories, it was probably because you had lacked sufficient education, and further should probably not be granted much weight for your opinions, because the more educated that you were had a positive correlation to the degree to which you would reject the idea that this was somehow a part of a conspiracy. But yet, at the same time, around July 2020, according to the Washington Post, amongst Americans, months of discord about the coronavirus epidemic had transformed the cloth mask into a potent political symbol, touted by Democrats as a key part of communal responsibility. It has nothing to do with science of prevention of disease, labeled by some GOP leaders as a sign of government overreach, and as a scarlet letter pinned on the week, which also has nothing to do with the science of the effectiveness of a non-medical grade facial covering. Certainly interesting opinions evidencing the deep concern about the divisions in the political spectrum during a global public health crisis, with all concerned, even in a lethal public health crisis, finding all far more concerned in a natural selection predominantly about the outcome of an annual political contest, subordinating complexities of what was essentially a science problem, but at the beginning of the 20th century, considering just a smallpox epidemic limited to the vicinity of Cambridge, Massachusetts. Supreme Court Justice John Marshall Harlan had suggested in the case of Jacobson v. Massachusetts that the only competent evidence that could be presented to the court to prove these propositions was the testimony of experts giving their opinions, not on politics, but on science. By April 2020, according to the Pew Research Center, misinformation about the COVID-19 pandemic had spread, and many Americans had encountered conflicting narratives about how the new coronavirus had originated. They claim that scientists have determined the virus came about naturally, but there is some uncertainty about how it first infected people. But yet, and still, according to the Pew Research Center, while a plurality of the Americans, 43%, said the new coronavirus most likely came about naturally, nearly 3 in 10, 29%, said it most likely was created in a lab. What is the truth? By late May 2021, over a year later, according to the American president, the U.S. intelligence community had coalesced around 2 likely scenarios, but had not reached a definitive conclusion on this question. Described thusly, while 2 elements in the IC lean toward the former scenario, one leans more toward the latter, each with a low or a moderate confidence. The majority of elements do not believe there is sufficient information to assess one to be more likely than the other. Either or, one or the other, but nothing definitive or conclusive 1 year into a public health crisis by an assessment by the intelligence community. And according to a recent opinion editorial that had appeared in America's leading business publication more than 3 years after the start of the global pandemic, which would be redundant because a pandemic would be global, there has yet to be a comprehensive forensic investigation into its origins. And these journalists had concluded that with more than 1 million Americans dead from COVID-19 and an estimated 15 million dead worldwide, that's inexcusable. And yet 3 years into a global public health crisis, they reported not much progress regarding the differing views on the origins of a novel coronavirus, stating there were 2, and only 2, competing hypotheses. Some believe the novel coronavirus probably escaped from a laboratory in Wuhan. Others maintain the virus first jumped to people from the caged animals at a Wuhan seafood market, escape from a laboratory, or a zoonotic event in nature. And then called for the Congress, a body increasingly stymied by partisan bickering, to convene an official inquiry into the origins of the novel coronavirus to finally settle the question once and for all. However, if you were to ask Birger Sorensen, a scientist, Andrew Sosrud, a scientist, or Angus George Daglish, a scientist, about the novel coronavirus in May 2020, still early in the rush to just reject the normal strategy of letting one of these cyclical pandemics run its course. They occur about every 20 years, while prioritizing in triage the treatment of those most severely affected by adverse outcomes, and rather than try to rush a preventative vaccine, as at least one former MI6 director may have noticed at the outset of a scientific report about a curiously named vaccine candidate looking more like bivouac than anything else, comparing their work to others, stating, although no other coronavirus disease 2019 COVID-19 vaccine design program appears to follow this methodology, we believe, as scientists, from experience as scientists, that successful vaccine design logically logically starts with a thorough understanding of the etiology, origins, cause of the target virus, which appears in this case to be quite singular. An etiology of the target virus that appears to be quite singular or novel in itself. Why would they say that as scientists? On January 31st, 2020, in an email to Dr. Anthony Fauci, similarly, Dr. Christian G. Anderson, a scientist of the Scripps Research Center, had written, "The unusual features of the virus make up a really small part of the genome, less than 0.1%, so as to look really closely at all the sequences to see that some of the features potentially look engineered." Dr. Anderson added, "Eddie, Bob, Mike, and myself all find the genome inconsistent with expectations from evolutionary theory. For scientists examining the genome under a microscope, not just persons with uninformed opinions, had concluded that the genome was inconsistent with the expectation of evolutionary theory. And upon receipt of this critical email, before Dr. Anderson would soon reverse his position to become the leading advocate regarding the zoonotic evolution theory, Dr. Fauci had, intriguingly, transmitted to his deputy, Dr. Hugh Auchincloss, an email marked as urgent and stating with emotion, "It is essential that we speak this AM or morning, a Saturday morning. Read this paper as well as the email I will forward to you now. You will have tasks that must be done today." A Saturday morning. And the research report that Dr. Fauci had forwarded to his deputy, at least coincidentally, after his receipt of the email from Dr. Anderson questioning the origins, and intriguingly transmitting his urgent email to Dr. Auchincloss, his deputy, on a Saturday, had included a science report dated from back in 2015, 5 years before the current pandemic, and regarding a SARS-like cluster of circulating bat coronaviruses that shows potential for human emergence, while also announcing not a zoonotic evolution, but rather the successful cultivation of this SARS-like coronavirus in vivo, or in tissue of a host, which had been done before, at least as early as 2013 by Zi Ying Ji, but also for the very first time for any virus, a successful cultivation of this SARS-like coronavirus in vitro, not within a living tissue, but in just a petri dish culture. It had never been done before, at least in the open source. And all of these experiments raise at least the suggestion of dual-use research of concern, and certainly a reasonable suspicion, which, at least according to the Pew Research Center, certainly around half of Americans with a high school diploma or less education, 48%, appeared to have found, which compares with 38% of those who have completed some college but have no degree, 24% of those with a bachelor's degree, and 15% of those with a postgraduate degree. The exact inverse correlation, or at least inconsistent with expectations from evolutionary theory, so to speak, in a natural selection, finding those with the most education curiously dismissing a reasonable course, very similar to the rejection of Bivouac-19 as a vaccine candidate. Berger Sorensen, Andros Sussred and Angus George Dalgish in May 2020, who had reported, although no other coronavirus disease 2019 COVID-19 vaccine design program appears to follow this methodology, we believe from experience that successful vaccine design logically starts with a thorough understanding of the etiology of the target virus, which appears in this case to be singular. And these were scientists conducting science work and looking at the science. But how many of the around half of Americans with a high school diploma or less education, or even those 38% who had completed some college but have no degree, or those 15% that had a postgraduate degree had decided during a big science exam, which we shall call a pandemic, decided to read the book? Would that be smart? And again, in July 2020, that critical transition to reopening, appearing in the BBC Science Focus, it had been reported that Dr. Tom Jefferson from the Center for Evidence-Based Medicine, CEBM, at Oxford University has pointed to a string of recent discoveries of the virus's presence around the world before it emerged in Asia as growing evidence of its true origin as a global organism that was waiting for favorable conditions to finally emerge, apparently. Had long been with us. And in fact, traces of COVID-19 had been found in sewage samples from Spain, Italy, and Brazil, which predate its discovery in China, which might suggest that singularly an infected bat, or pangolin, or even Chinese crater king cobra was not just a fluke occurrence that happened to have found optimum conditions to set off a once-in-a-lifetime lethal public health crisis, and as reported by the BBC in July 2020, a preprint study, which had not yet been peer-reviewed, claimed to have found the presence of SARS-CoV-2 genomes in a Barcelona sewage sample from 12 March 2019, a finding noted even by the World Health Organization in its global study completed in February 2021, a report in which even the WHO director had found objections to its conclusions. Insufficient. That report, some 120 pages long, if you care to read it, had conceded that rare laboratory accidents do happen, and different laboratories around the world are, in fact, working with bat COVs. They conceded that when working in particular with virus cultures, but also with animal inoculations or clinical samples, humans could conceivably become infected in laboratories with limited biosafety, poor laboratory management practice, or following negligence. But they concluded that there is no record of viruses closely related to SARS-CoV-2 in any laboratory before December 2019, or genomes that in combination could provide a SARS-CoV-2 genome. But just logically, think. If you were a scientist and you were working on a virus that happened to be SARS-CoV-2, already hundreds of thousands of people have died, and now someone wants to ask you if you were working on this virus. Logically, do you expect someone to come clean? You look like an intelligent person. But the World Health Organization report, 120 pages long, concluded that regarding accidental culture, prior to 2019, in December, there is no evidence of circulation of SARS-CoV-2 among people globally. and the surveillance program in place was limited regarding the number of samples processed, and therefore the risk of accidental culturing SARS-CoV-2 in the laboratory is extremely low. Findings that even the WHO director could not accept, and most would not characterize the WHO director in the class of around half of Americans with a high school diploma or less education, 48%. It is of note that at that same time, Dr. Tom Jefferson at the Center for Evidence-Based Medicine at Oxford University had joined with his colleagues Carl Hannigan and John Brassi on March 26, 2020, just weeks after the pandemic declaration, to state if readers are confused by the mass of contradictory information, so we can be assumed, what can be assumed by this post is that no one really knows what is going on, least of all governments and professional associations, which seem at odds with news outlets as to how many of their members have died. As our grandfathers used to say, when you do not know what is going on, do nothing. This is what we plan to do from our privileged position: observe and monitor the situation without jumping to conclusions. A manifesto of neutrality. Just do nothing. Stay away. Would one of education conclude that Drs. Jefferson, Hannigan, and Brassi at Oxford University were in that class of around half of Americans with a high school diploma or less education, 48%. And at least Birger Sorensen, Andrews Sastrud, and Angus George Dalgish in May 2020 had been advocating for a thorough understanding of the etiology of the target virus, which appears in this case to be quite singular, unique, novel, different, distinct, strange. Does it raise a reasonable inference of suspicion to a person with far more formal education, including college or even advanced degrees, that the controversial Peter Daszak, apparently the lone American, along with several scientists in China, had been a part of what satisfies the description of a dual-use research of concern project in 2013, during which Xing Yiji had been successful in the cultivation of a SARS-like coronavirus in 2013. Does it raise a reasonable inference of suspicion to a person of far more formal education, including college or even an advanced degree, that in March 2015, during conduct of what may be fairly described as dual-use research of concern at the University of North Carolina, Chapel Hill, in joint cooperation with scientists from the Wuhan Institute of Virology, research about which Dr. Fauci had clearly expressed some sense of urgency in his email to his deputy, Dr. Auchenglass, on a Saturday regarding the SARS-like coronavirus that had been for the first time for any virus cultivated in vitro, not just in vivo, that Ralph Barrick and several others at UNC Chapel Hill had secured for themselves a patent for the methods and composition for chimera coronavirus spike proteins, so they could do it again and again and again. The very part of the genome for a novel coronavirus that has been so often associated with the reason for the alleged zoonotic evolution and the current pandemic. Would that level of suspicion rise in a person of far more formal education, including college or even advanced degree, if they were to consider that the very same Ralph Barrick had on April 19, 2002, almost 2 decades before the current pandemic, involving the novel coronavirus, not just a novel coronavirus, which at least according to Wei Ji, possesses the chimerically aberrant from nature characteristic of an ovidian colon usage bias or snake ability, even though coronaviruses are exclusive in infections to mammals and birds, had made application for the methods for producing recombinant coronavirus. Just 1 year before, not the current pandemic, but the SARS outbreak in Hong Kong, and also in the year in which not only the human coronavirus first discovered in 1965, EC 229E, and more akin to a chicken coronavirus, a marginal co-infecting agent in the cold, had given rise between 2003 and 2005 to the emergence of a total of 5 human coronaviruses. 5. And today we have 7, including SARS, all related to the same bat found in Yunnan, the location of a military-grade virology laboratory, rarely if ever discussed in news accounts, and now making up as much as 30% of our common cold. By July 2020, according to the Pew Research Center, most Americans, 71%, had heard of a conspiracy theory circulating widely online that had alleged that powerful people intentionally had planned the coronavirus outbreak, and a quarter of U.S. adults saw at least some truth in it, including 5% who had said it is definitely true and 20% who said it is probably true, according to a June Pew Research Center survey in 2020. But how many took the time to do the homework and read reports to try to confirm or deny? And you look like an intelligent person. According to the Pew Research Center in July 2020, however, the share of Americans who saw at least some truth to the theory differed by demographics and partisanship. And at least according to these learned survey researchers, educational attainment is an especially important factor when it came to perceptions of the conspiracy theory. Around half of Americans with a high school diploma or less education, 48%, said the theory is probably or definitely true. But they emphasize that compares with 38% of those who have completed some college but have no degree, 24% of those with a bachelor's degree, and 15% of those with a postgraduate degree, with the implication that if you had believed the conspiracies, it was probably because you lacked sufficient education, and further should probably not be granted much weight for your opinions. But it also suggests that if this person had education, they could also reasonably assume that you would not do the homework to find out the truth. At the end of December in 2021, the WHO director had told the United Nations that surely we have learned by now that we underestimate this virus at our own peril. And even Dr. Rochelle Walensky has said of this virus that Dr. Fauci had admitted has fooled us before. It isn't stupid. And persons including scientists at the Center for Evidence-Based Medicine at Oxford University, former CDC Director Dr. Robert Redfield, former MI6 Director Sir Richard Dearlove, and senior officials at the State Department whose investigation was shut down by the current administration, have taken a position on the origins of a virus that Drs. Berger Sorensen, Andres Sussrud, and Angus George Daglish in May 2020 had been advocating for a thorough understanding of the etiology of the target virus, which appears in this case to be quite singular. And even the World Health Organization had, at the very beginning of the emerging public health crisis, had said of this disease that even it had expressed some doubts that it had been attributed to even an infectious virus at all, being transmitted normally from person to person, and in major recommendations had designated for countries around the world with imported cases and or outbreaks of COVID-19 to fully educate the general public on the seriousness of COVID-19 and their role in preventing its spread, which, considering the continuing divisions regarding the origins, has yet to have occurred, finding the origins question still lingering 3 years into a pandemic, with what the Wall Street Journal claims may have wrought an unacceptable loss of over 15 million fatalities worldwide. And how many? In a global public health crisis involving a science problem, took the time under evolutionary pressure to read the science reports and do the homework. I believe it's one of the most ghostly manifestations I have ever seen. Whether it is real or simply conjecture, one of those things that people seeking to find some mystery to pull themselves into believing, but with some other perfectly rational cause, is a question that only you can answer with your capacity to reason. Impossible. So was Xeroxing and holography just a few short years ago. In fact, so were videotape replays like the one you're watching right now. People have been proclaiming the marvels of science for thousands of years, and maybe one day we shall discover the origins of this novel coronavirus. What a tremendous gain that would be for science. Yet, what a tragic loss for storytelling. And be sure to join us next time as events evolve with science in a near-ending pandemic termination that has yet, as of yet, with an estimated 15 million dead worldwide, leaves still many unanswered questions, including exactly how this virus that isn't stupid had, without a prescient thought and merely through natural selection, managed so quickly and absolutely to have conquered the entire world. This briefing is unclassified. This advertisement was authorized by Mike Weber.